It has to be one of the most frustrating things ever. You're in pain, real pain. You go to the doctor, they send you for an x ray, and then you get the news. Everything looks normal, but you know it's not. So let's get into this, because it's a super common medical mystery.
I'm guessing this is the exact question running through your head. I mean, you're the one feeling it every single day, but the very first picture they take of what's going on inside your body shows, well, nothing. It's enough to make you think you're imagining things, or that nobody actually believes you.
So, right off the bat, let's get this straight. You are not imagining it. Your pain is 100% real. And in this explainer, we're going to dig into the evidence together and figure out why a normal x-ray is almost never the end of the story. In fact, it's usually just the beginning. Okay, so to crack this case, we have to start by understanding the tool we're using. X-rays are an amazing piece of technology, for sure, but just like any tool, they have limits. You could even call them blind spots.
Think about it like this. An X-ray has a superpower, and it also has a kryptonite. Its superpower is seeing really dense stuff, like bone. That's why it's the absolute go-to for finding a fracture or seeing the signs of arthritis. But its kryptonite? That's soft tissue. Things like ligaments, muscles, the discs in your spine, they're basically invisible to a standard X-ray. And guess what? That's so often where the pain is actually coming from. All right, so if our first responder, the X-ray, can't find the problem, it's time to call in the specialist investigators. And in the world of medical imaging, that means we're talking about the CT scan and the MRI. Let's take a look at what these guys do. First up, you've got the CT scan. The simplest way to think about a CT is like a superpowered 3D version of an X-ray. It takes a whole bunch of X-ray images from all these different angles and then uses a computer to stack them into detailed slices. This gives doctors a way more intricate view of what's going on, especially with your bones. And then you have the MRI. Now, this is a completely different ballgame. An MRI doesn't use any radiation at all. Instead, it uses incredibly powerful magnets and radio waves. And that's what makes it the undisputed champion, the gold standard for getting these amazingly clear pictures of all that soft tissue the X-ray just couldn't see. We're talking muscles, ligaments, nerves, you name it. So you can see here, it's all about picking the right tool for the job. A CT scan is what a doctor will turn to when they suspect there's a really subtle or complicated bone issue that the first X-ray might have missed. But an MRI? That's the go-to when all signs are pointing towards a soft tissue injury, like a torn ACL in your knee or a herniated disc in your back. So that really leads us to the most critical part of this whole process. How does a doctor actually decide which of these fancy tools to use? It's definitely not a guess. There's a clear, logical process behind it.
Believe it or not, this entire decision-making process starts with you. It all begins with your symptoms. A good doctor listens really carefully to how you describe the pain. Is it sharp? Is it dull? Is it a burning sensation? Is there any numbness? Based on that conversation, they start to form a hypothesis, a hunch. Okay, does this sound more like a bone problem or a soft tissue problem? And only then do they pick the scan that's got the best shot at giving them a clear answer. Let's make this really concrete with some examples. Let's say you have this deep pain in a joint and the X-ray didn't show anything conclusive. Well, a CT might get ordered to look for a tiny hairline fracture. But if you twisted your knee playing basketball and now it feels wobbly, or you've got that classic back pain that shoots down your leg, that screams ligaments or nerves. And that, my friends, is MRI territory. And this all brings us to what is maybe the single most important point of all. Even with all this incredible technology, the whole diagnostic process, it doesn't start with a machine. It starts with you. Your ability to talk about what you're feeling is absolutely critical. The details you see here, which come from guidance by medical professionals, are the vital clues your doctor needs. So please, don't downplay your pain. Be specific. Tell them if it's sharp. Mention any redness or swelling. Tell them if it wakes you up at night or if you feel any of that weird numbness or tingling. Every single one of those details helps guide the entire investigation. I just love this quote because it really puts everything in perspective, doesn't it? Any scan, an X-ray, a CT, an MRI, it's just a snapshot. It's one single frame. But your experience, the story you tell about your pain, that's the whole movie. It gives all the context, the plot twists, everything needed to really get what's going on.
So the next time you're in that frustrating spot with a normal scan but pain that won't quit, just remember this. The goal isn't just about getting a fancier, more expensive scan. It's about using your experience, your story, to help your doctor choose the right scan. Because so often the path to getting a real diagnosis doesn't start with a better image. It starts with a better conversation.